Zinc deficiency and immune function supplementation. Zinc deficiency can impair immune function, leading to increased susceptibility to infections and reduced immune response. Supplementation with zinc may improve immune function in at-risk populations. Overview. Zinc is an essential mineral involved in numerous physiological processes, including immune function, wound healing, and DNA synthesis. A deficiency in zinc can lead to impaired immune responses, increased susceptibility to infections, and delayed wound healing. In clinical practice, zinc supplementation is often considered for patients with immune dysfunction or those at risk of deficiency. Pathophysiology/mechanism of action. Zinc plays a critical role in the development and function of immune cells, particularly T cells and macrophages. It is required for the proliferation and activation of these cells, and its deficiency can lead to reduced immune response. Zinc also acts as a cofactor in the production of cytokines, which are essential for immune signaling. In the absence of sufficient zinc, the body may experience a reduced ability to mount an effective immune response, increasing the risk of infections and chronic inflammation. Clinical features/indications. Symptoms of zinc deficiency may include impaired wound healing, recurrent infections, fatigue, and loss of taste or smell. Clinical indications for zinc supplementation include patients with chronic illness, malnutrition, or those with a history of recurrent infections. Supplementation is also indicated in patients with immune deficiencies, such as those with HIV or those undergoing chemotherapy. Diagnosis/monitoring. Diagnosis of zinc deficiency typically involves a combination of clinical assessment and laboratory testing. Serum zinc levels are commonly measured, and a deficiency is defined as a serum zinc concentration below 65 g/dl. Additional tests may include serum protein electrophoresis, complete blood count, and immune function tests. Monitoring is essential to ensure appropriate dosing and to avoid toxicity, which can manifest as nausea, vomiting, and neurological symptoms. Treatment/management. The recommended dose of zinc for supplementation is typically 25 to 50 mg/day, depending on the individual's age, health status, and severity of deficiency. Supplementation should be guided by clinical evaluation and laboratory results. It is important to note that zinc is a mineral that can be absorbed in the gastrointestinal tract, and its absorption is influenced by dietary factors. In cases of severe deficiency, intravenous zinc may be considered, but this is typically reserved for patients with acute illness or those who are not responding to oral supplementation. Key clinical points. Key points: zinc deficiency can lead to immune dysfunction and increased susceptibility to infections. Serum zinc levels are the primary indicator of deficiency. Supplementation should be individualized based on clinical status and laboratory results. Monitoring is essential to prevent toxicity and ensure therapeutic efficacy. Thank you for watching. For the full article, visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.